Good day everyone, my name is Chu Liu Imm. I'm going to present my research project entitled Development of Honey-PLGA Microparticle for Treatment of Chronic Periodontitis. For introductions, chronic periodontitis affecting the soft and hard tissue around the teeth caused by the plaque bacteria. And this is the picture of chronic periodontitis. Malaysia prevalence. Based on NOSHA 2010, the prevalence of moderate and severe periodontitis were 30.3% and 18.2% respectively, and this disease caused the economic burdens. Treatment of chronic periodontitis. There are two types. First, basic treatments, scaling and root debridement. Second, adjunct treatment, local or systemic delivery of antimicrobial such as antibiotic. But the use of frequent antibiotics will increase the antibiotic resistance and adversely affect the patients. So, the alternative treatment is needed to avoid the super infections. In this research, we choose honey. The physical properties of honey are brownish liquid, acidic and viscous liquid. The content of honey include sugar, water and other substances such as mineral, vitamin, enzyme and hydroxymethyl furfural. The therapeutic properties of honey include antimicrobial, antioxidant which help in wound healings, anti-inflammations and immune booster. In dentistry, honey has been used to treat the oral problems like inhibit dental plaque formations and aid in controlling gingivitis. However, honey is easily diluted and washed away by saliva. Three types of honey used in this research. First, kelulut honey, tualang honey, and manuka honey. As the honey is easily diluted and washed away by saliva, so we choose microparticle. Microparticle is a biomaterial used for microencapsulation and to prolong the delivery of therapeutic drugs, and microparticles are proven safety. Examples of material used for microparticle include polylactic co-glycolic acid and chitosan, a marine-derived polysaccharide. Objective of this study. First, to formulate honey-PLGA microparticle using three types of honey, namely kelulut, tualang and manuka. Second, to evaluate the physical and biological properties of formulated honey-PLGA microparticle. Third, to assess the antibacterial properties of formulated honey-PLGA microparticle. Methodology. First, preparation of honey-PLGA microparticle. The honey-PLGA microparticle were prepared using diffusion solvent evaporation methods. Second, characterization of honey-PLGA microparticle. A. Assessment of surface morphology. The particle size and surface morphology were analyzed using FASM analysis, field emission scanning electron microscopy. And B. Assessment of surface charge. The surface charge of microparticle were analyzed using zeta sizer analysis. And C. In vitro release profile study. The supernatant of sample were collected and subjected to UV spectrophotometer to detect. And the third one is evaluation of antibacterial activity. The honey-PLGA microparticle were mixed together with the bacterial suspension and incubate for 24 hours, and then spread and culture on the plates. After 2 days, observe the plate to see the result. Here is the picture of the formulated honey-PLGA microparticle, which appear in white powder for all honey types with no difference. Control microparticle, kelulut honey microparticle, manuka honey microparticle, and tualang honey microparticles. Here is the result for FASM analysis, and here is the image shown by the FASMs. Based on the image, we can see that all types of honey-PLGA microparticle were spherical in shape and had a smooth surface without pore. The first one, kelulut honey microparticle. The size range are 1.408 to 9.103 micrometer. For manuka honey microparticles, the size range are 1.291 to 4.932 micrometers, and for tualang honey microparticles are 1.585 to 8.06 micrometers. Result for zeta sizer analysis. Based on the table, we can see that the net charge of all type of honey microparticle were negative, and the value of zeta potential does not reach 30, which means the honey microparticle were not stable. Result for in vitro release assay. The release profile against time for honey microparticle at 300 nanometer was significant, as the p-value is less than 0.0001 main effects. Based on the graph, we can see that tualang honey microparticle, which in pink color, has a higher release profile compared to manuka honey microparticle and kelulut honey microparticle. And all these three types of microparticle show the slow release effects. Result for antibacterial test. There are no antibacterial effects shown by all honey microparticles. Here is the result of the plate. The first one, positive control, no bacterial growth. Negative control, yes, bacterial growth. But for control microparticle, kelulut honey microparticle, manuka honey microparticle, and tualang honey microparticle also show the bacterial growth, which means all these samples did not inhibit the bacterial growth and no antibacterial effects. For discussions, honey samples were able to incorporate into microparticle to form Honey-PLGA microparticle. Based on Brukai et al. 2003, proved that propolis extractive solution can be incorporated into gelatin microparticles by spray drying techniques. Second, honey microparticle shows spherical in shape and has a smooth surface without pore, and the size ranging from 1 to 10 micrometer. Based on Lee et al. 2017, stated that polylactic co-glycolic microsphere was spherical and smooth, with average size about 8.5 micrometers. The zeta potential value of honey microparticle does not reach 30, which means honey microparticle were not stable and it will coagulate and fall to the bottom. If this subjected to the patient, the honey microparticle will fall down to the periodontal pockets. Next, the Honey-PLGA microparticle show slow release effects. Microparticles have the ability to prolong the retention of drug release, which can improve and sustain the release process. Honey microparticle did not show any antibacterial activity against Streptococcus mutans. This could be due to the low percentage of honey in the formulations, and the antibacterial activity of honey is related to its osmolarity, hydrogen peroxide content, low pH, phenolic acid levels, and flavonoids. When the honey is diluted to a lower concentration, all of those contents are also diluted, which resulting in a lesser antibacterial efficiency. For conclusions, all honey samples in this study were able to incorporate with other ingredients to form Honey-PLGA microparticles. The Honey-PLGA microparticles show heterogeneous in size, and all types of honey microparticle produced show slow release effects. However, the formulated Honey-PLGA microparticle did not show antibacterial effect against Streptococcus mutans. So, further study is needed in terms of improving the formulations to produce microparticles which are highly effective against the targeted microorganisms. Here is the references. That's all. Thank you.